Hi, I'm Dr. Nicole Vane of Moonlight Beach Dental, and this is a second segment on myofunctional therapy. I have with me Jessica, who's a registered dental hygienist and myofunctional therapist who works at the office of Jody's Jeweler. And what we're going to be doing is doing a quick intake observation of how she does an initial workup assessment on a patient. Our particular patient is a chiropractor who has had braces twice, and she's aware she has a tongue thrust. So I was initially going to do a tongue tie release and orthodontics for a third time, but knowing what I know now, it will not be successful unless we start having her learn how to retrain her tongue prior to us starting any treatment, because I want my treatment to be successful. I don't want her to have a fourth or fifth time. So that's where Jessica comes in with her expertise. So Jessica, if you want to explain your workup form, and then we'll start the video of how she does a workup.
Sure. So essentially when I do my quick screeners, these usually last between 20 and 30 minutes. And this can be done at the dental office. So I'm happy to come to your office and see the patients there before they decide they want to commit to further intensive evaluation and and therapy. I will do a look at their concerns. Do they have open mouth breathing? Do they have difficulty swallowing pills? Do they have jaw problems, temporomandibular dysfunction? Do they have any facial imbalance? Does their tongue, do they notice they have a tongue thrust? Are they a messy eater? For kids, lots of kids are messy eaters. Well, maybe there's a reason why they're a messy eater. So I also ask any sleep questions. A lot of times my functional therapy is involved in treating sleep apnea. So I will ask them questions about their sleep. I will also look at the factors to orofacial myofunctional disorders. Do they have a sucking habit, maybe a non-nutritive sucking habit like a thumb or a pacifier for a child? Do they have tongue weakness? Mm-hmm. You know, tongue is a muscle. And a lot of times the back part of the tongue is extremely weak. So I look at that. I will also look at their vaulted palate, if they have a high vaulted palate, if they have enlarged tonsils. I will also look at their bite and also the tongue restriction. Do they have a tethered oral tissue? Mm-hmm. Is their tongue mobility, are they able to move their tongue freely up and out, side to side? So it's not just looking at the tongue, but seeing the tongue function. Yeah. Can it truly function? And then I give a different look at the assessment of if they don't have, or if they do have a tongue restriction, then I will have a workup of referrals. I have either someone like yourself who can do frenectomies, or ENTs can do frenectomies. So I have, again, it's teamwork.
Yeah.
It's a teamwork approach. Looking at their tonsils and adenoids. Do they have enlarged tonsils? Maybe then they need to see an ENT for that assessment. And then we have a plan of action. And that plan of action might be, you need to go see your orthodontist first and expand that palate before we need to get room for your tongue to lift up. Mm-hmm. So go see your orthodontist, get into an expander, or find out what needs to be done with them, and then come see me during your treatment. Or maybe they're ready to start and they need a full evaluation. That's where we spend about 90 minutes, and I watch them eat, drink, chew, swallow. I look at posture, I hear their speech, and we take photos, including full body, looking at the mouth, the posture in the mouth, and then we decide what kind of sessions do they need.
Okay. So we'll bring in our patient, and you can see what an evaluation will look like for an adult. It can be a little different, as she said, for a child, depending on the age. But I'm excited to see this in action.
So I'm going to do a quick 20
or so minute assessment
Okay.
to see if we need to further evaluate for any orofacial myofunctional disorders.
Okay.
Do you find yourself breathing through your mouth or your nose most of the time? I know that's kind of an odd question to ask.
Could it be both?
It can be both. Some people do a little bit of both. When you wake up in the morning after sleeping all night, do you find your mouth being dry, or do you find sometimes your gums are a little more irritated in the morning from
No.
being overly dry?
I started doing a myo brace,
Okay,
so that has made me close my mouth.
good, good.
And that it feels good when I wear that at nighttime. When I don't wear it at nighttime, I notice a big difference. I'll wake up with my jaw being sore.
Okay.
And I do feel like more of that dry mouth.
Okay, so you might be a little bit of both. Okay, and now after just take a deep breath. And you're relaxed, where is your tongue right now?
It's at the top of my mouth.
It's on the roof of the mouth. Can I see where the position is? Okay, good.
But this is with the myo brace, so
So I guess maybe the questions that you want to, I would like to ask, think of where you were before you started myo brace.
definitely my tongue was pushing on the front of my teeth.
Pushing on the front of the
Yeah,
teeth. Okay.
100%.
Okay, I'm just making myself some notes here. Do you ever find yourself drooling
If I take a nap, yes.
if you take a nap? Okay. So that means your mouth is open. Yeah.
When I'm really tired, yes.
Okay. Okay, can I have you take a quick sip? Just put a little bit in your mouth.
Okay.
And then I want you to try to, I call it a smile swallow, so don't swallow. I want you to smile and swallow. Okay, so that's good. But let's see. Open. And let's see, I'm going to take a small sip and hold it. Okay, and swallow. Okay. All right, good. So there, I could see the tongue starting to peek through, but I think possibly with the myo brace,
Yes, world of difference.
you've been able to kind of redirect your tongue, but I could still like it wants to push
Yes.
forward. Exactly. You know, we swallow between 500 to 800 times in a day, and so we want that correct swallow to be every single time.
Right, okay.
Okay. Are you able to eat most foods without difficulty? Do you find, are there foods that are harder to chew and swallow? Are there foods that you avoid?
No. I
Okay.
feel like I can eat most
Okay,
food.
okay. Do you ever find yourself choking or gagging? Okay.
No.
Do you have you ever been to a speech therapist or had any speech issues?
No.
Okay. How's your sleep? Do you find yourself sleeping all night, or do you snore? Are you told you snore?
I did have my tonsils removed when I was like 7 because I
Okay.
was snoring.
Ah,
Because I
okay.
so I don't know if that was more this or what. I don't believe that I snore. I sometimes will wake up once in the nighttime.
But not regularly, so no major problems. Good. Okay. Do you ever find yourself clenching or grinding your teeth?
Not grinding, but sometimes clenching.
Okay, okay. Do you ever get any jaw pain or headaches?
If I don't wear my myo brace, yes.
Okay.
And that was why I came into Dr. Vane, was to start to handle this, because I'm noticing a few things. There's definitely tension in my jaw. I know that I have been told I have TMJ in the past. I've had orthodontics twice. And
Okay.
my gap in my teeth comes back, and my overbite tends to come back.
Okay.
Unless I'm really doing something to train it
Okay.
consistently. And then the other thing that I was noticing was before the myo brace is I was feeling like my airway was collapsing when I was sleeping.
Oh,
And so
okay.
that's why I like to wear the myo brace to sleep too, because I can tell, and especially laying on my back, I was like, wow, this overbite it's like everything was sinking inwards, and I would, and then I'm like, wow,
Sure.
if I push my jaw
Sure.
forward, I
Okay.
feel the difference.
Sure. Okay. Absolutely. I don't see any posture issues or facial imbalance, so that's all good.
Probably the same chiropractor.
Did you? I know you must have a good chiropractor.
Right, I know. Like if I wasn't, I'd probably have be a whole more messed up.
Exactly. Did you ever have a sucking habit, like thumb sucking, pacifier use, anything like that?
Never.
Chew on like clothes, like shirts, anything? Okay. And I don't see that you have a lip incompetence, so your lips are able to close. All right. So let's see. I'm going to have you open and stick out your tongue and then press on this little toothette here to the side. Okay. And then again to the side. Yeah. So you're using your jaw to try to move. Okay. And then stick it out again and lift up. Okay. And stick it out again and push down. Okay. So I do see some tongue weakness.
Okay.
Let me look at your, I'm going to pull your lip up. Okay. And down and open. And now bite down all the way. I'm looking at your bite. So you definitely have an overjet. But you're a little bit of a class 2. So it looks like you have a class 2 occlusion, which means the molar relationship between the tooth. Instead of it being more like this, it's more like that. So it's a little opposite, which causes your jaw to be pushed back.
Yep.
That's why before you were doing the myo brace, you were having breathing issues. Okay. So open real wide and lift your tongue up to the roof of your mouth. Okay. And now can you stick it out all the way? Good. And now can you move to the left and now to the right? Okay, good. And then try to lift your tongue up all the way. Okay. So it's definitely restricted. I mean, that you can't really, even by when you stick your tongue out, so stick it out again. I'm seeing a little bit of a heart-shaped tip, and that indicates that the middle portion or the back portion of the tongue is tethered for sure. Let me just look at your, let's see, you had your tonsils removed, is that right? Okay, can I have you lift up a little bit and open? You've got a really high vaulted palate. Okay, and close down. Okay. And this frenum here is a little, that's what's causing the two front teeth to kind of flare outward a little bit. And so maybe that needs to be assessed. So I'll make a note of that. And so that's it for that part. I would say no tonsils, but you do have a high vaulted palate. And can I have you close one nostril and breathe? Okay, now the other one. So a little congested on that right side. Do you generally have congestion, or are you not too bad?
I don't think so.
Okay.
When I don't do dairy.
Okay, sure. And possibly maxillary labial frenum is restricted, and malocclusion, I would say you're a class 2. So what I would do is definitely would love to follow up with a more involved evaluation that would involve the watching you eat and drink and taking pictures and doing a more detailed assessment, and then get started. See you maybe between 2 to 4 times before you have the frenectomy. And then would like to see you either the day of the frenectomy or day after, and really work on getting mobility of the tongue, really work on the making sure that you know what to do. And then definitely continue with good tongue posture,
Okay.
and do a full myofunctional assessment and therapy. I think you're a great candidate for that.